Hello everyone, this is Anushya Goswami, your faculty for child health nursing, and today we'll be discussing about a topic, very important topic, that is breastfeeding. Okay, so let us see about it. So breastfeeding is the ideal nutrition containing all the nutrients for the optimum growth and development of the neonate, that is from birth to 6 months, right? So, exclusive breastfeeding for 6 months is the most effective public health intervention that can reduce neonatal mortality by 20% and under 5 mortality by 13%. After 6 months, complementary feeding should be started and breastfeeding should be continued for 2 years or as long as the mother wants. So, breastfeeding is the only and the most ideal nutrition, right, that is required for the growth and development, for the proper growth and development of a neonate, right, from birth to 6 months. Why till 6 months? Because after 6 months, only breastfeeding, okay, only the mother's milk does not suffice for the optimum nutrition of the baby. Okay, so the baby needs the introduction of uh, other foods as along with breastfeeding after 6 months, right? So exclusive breastfeeding. So what is exclusive breastfeeding? Exclusive breastfeeding means feeding or giving only and only breast milk for 6 months. Okay. So the baby should not be given any kind of fluid other than breast milk for 6 months, right? No water, no honey, no sugar syrup, nothing. Okay. However, if the baby is required to be given any vitamin drops or any kind of medication, right, uh, that can be given as per the prescription of the physician, right? But if the baby is normal and the healthy and does not need all those things, extra medications and all, only and only breastfeeding should be given. So that is known as exclusive breastfeeding, okay? And for till when it should be given? Exclusive breastfeeding till 6 months, okay? And research has been seen that if the babies are given, or those babies that are given exclusive breastfeeding for 6 months, the neonatal mortality rate of those baby is reduced by 20% and the under 5 mortality rate is reduced by 13%. Okay. So if when we introduce solids, we can say solids or other foods, okay, to the baby after 6 months, so that is known as complementary feeding, okay, and it should be started after 6 months, right? So after exclusive breastfeeding, okay. And however, even if we start complementary feeding, the breastfeeding should not be stopped, okay. It can be continued for 2 years or as long as the mother wants to feed her baby. Okay. Okay. Next, coming to the physiology of lactation. So, how the lactation in the breast take place. Okay. So first is mammogenesis. So mammogenesis means growth of the breast, right? So this occurs during the antenatal period of the mother, right? So we have seen that, or maybe you have studied that in the physiological changes of, during antepartum period, right? So, sorry, during antenatal period, right? So you have heard that the enlargement of the breast. So that enlargement of the breast is nothing but the breasts are getting ready for the lactation in the postpartum period, right? So uh, the size of the breast will increase, okay? The areolar size will become more deeper in color. If you have seen a pregnant mother, you can notice, right? Okay, the nipple becomes more prominent and uh, the blood vessels can be more clearly visible in the breast, right? So this mammogenesis is triggered by some of the hormones, which includes estrogen, insulin, okay, prolactin, Okay, so also adrenal corticosteroids. Okay, so all this triggers the process of mammogenesis. Okay. Next is lactogenesis. So what is lactogenesis? So the functional change of the breast so that they can secrete the milk. Okay. Lactogenesis is for secreting the milk, right? So it is divided into two phases. The first one is lactogenesis 1. So lactogenesis 1 begins from mid-pregnancy till 2 days after birth, right? So from antenatal period till the postnatal period. So only 2 days of the postnatal period, right? It involves differentiation of alveolar epithelial cells and stimulation of milk synthesis by prolactin. So lactogenesis 1 is being triggered by the hormone prolactin. Okay. So prolactin is responsible for milk synthesis. Okay. Next is lactogenesis 2. So lactogenesis 2 begins from third day of postpartum to 8th day of postpartum. So that is after the delivery of the baby, right? So it is precipitated by the reduction of progesterone. Okay, so here what happens? The progesterone reduces. So the breast becomes full, warm, and produce large amounts of milk, right? So that is about physiology of lactation. So that there are two processes that takes place in the physiology of lactation, that is mammogenesis, meaning the growth of the breast, okay? So the overall breast will grow, okay, with the ductal system and everything, okay. Next is lactogenesis. So lactogenesis is for secreting the milk, okay. So question might come, the meaning of mammogenesis or meaning of lactogenesis, okay. So this you can remember, okay. Next is coming to the reflexes of breastfeeding. So this is a very important topic. Okay, reflexes of breastfeeding, prolactin reflex and oxytocin reflex. It is a frequently asked question in the entrance examinations. Okay, so reflexes, there are reflexes in the mother and reflexes in the baby as well, right? So what are the reflexes in the mother? First one is prolactin reflex. So prolactin is a hormone produced by the anterior pituitary, right? So we all know, we have studied anatomy and physiology. So it is a hormone produced by the anterior pituitary. And as soon as the baby sucks, the nerve endings in the nipple carry messages to the anterior pituitary, which in turn releases prolactin and promotes milk secretion from breast. Okay, so this reflex is known as milk secretion reflex, right? So what happens in prolactin reflex? As soon as the baby sucks the mother's nipple, okay, what happens? The nerve endings in the nipples get activated and it sends messages to the anterior pituitary. Okay, so the anterior pituitary will release prolactin and it promotes the secretion of milk from the breast. That is why this reflex is known as milk secretion reflex. Okay, so this is very important. Milk, that is why I have put in bold letters. So which hormone is responsible for secretion of the milk? Okay, or synthesis of the milk? That is none other than prolactin. Okay, so please remember this. This is very important. This is a frequently asked question. Okay, so in almost everywhere you will find at least this question related to breastfeeding. Okay. Next is oxytocin reflex. So oxytocin is a hormone produced by the posterior pituitary. So we all know, right? Oxytocin is produced by posterior pituitary. It helps in contraction of the myoepithelial around the glands, okay, leading to ejection of the milk from the glands into the lacteal sinuses and the lacteal ducts. So what happens is prolactin only secretes the milk, which is getting, okay, stored in the breast. But for the baby to get the milk, it has to come out from the breast, right? So that milk that is coming out from the breast, from the nipple, that is being done by the oxytocin reflex. Okay. Same here also, as the baby sucks, okay, the mother's nipple, the message goes to the posterior pituitary, which secretes the oxytocin, and oxytocin works on the myoepithelial around the glands, which contracts. Okay, the ducts will widen. Okay, the myoepithelial will contract, which will lead to the ejection of the milk. So that is why it is known as milk ejection reflex. It is also known as let down reflex. Okay, so let us understand from the picture. So you can see in the first picture, right? You can see the baby is sucking. Okay. So here you can see the baby is sucking, okay, and there is nerve endings, or right, or suckling the mother's breast. So that there is nerve endings at the nipples, okay, which is sending the message to the anterior pituitary, right? And anterior pituitary is in turn releasing the prolactin, which is working on the synthesis of the milk, right? So there are some hindering factors and there are some enhancing factors for this prolactin reflex or milk synthesis reflex, okay, or milk secretion reflex. Factors like emptying of the breast fully, okay, then feeding of the baby at night, okay, these factors, okay, enhance the prolactin reflex. However, some factors like the mother's discomfort while feeding the baby, okay, if the mother is not feeding the baby very comfortably and she's feeding the baby with lots of discomfort, or if the mother is having pain while feeding the baby, okay, maybe sore nipple might be there, cracked nipple might be there, okay, so in those cases these prolactin reflexes may get hindered, okay. So let's see the next picture. So the next picture is the let down reflex. So that is none other than the oxytocin reflex. So oxytocin reflex is also known as the let down reflex, okay, because it leads to the ejection of the milk, okay. So here also same, I have already told you, baby will suck on the mother's breast to receive the milk, which triggers the nerve cells at the nipple and sending the signal to the posterior pituitary, right? So the posterior pituitary will secrete oxytocin. Oxytocin works on the milk ducts, right? I have told you the ducts will widen and the myoepithelial around will contract, which will lead to the ejection of the milk, right? So again, I'm telling you, prolactin is for secretion of milk. Oxytocin is for ejection of milk, okay? So basically you can remember is prolactin is responsible for the production of the milk, okay, in the mother's breast. And oxytocin is responsible for the ejection of the milk, right? So how you can remember? A simple way how I used to remember is PP and OO. So PP is prolactin produces, okay? Oxytocin oozes. So if you can remember like that, okay? So that is about the reflexes in mother. Now coming to the reflexes in baby. So reflexes in baby is easy, right? So there are three reflexes in baby: rooting reflex, sucking reflex, and swallowing reflex. So you can see in a picture, the first picture is rooting reflex. If we keep a finger, okay, and stimulate the side of the baby's mouth, what happen is the baby's head turn towards the side of the stimulation, and as well as along with that baby's mouth opens wide with the tongue thrusting outside, right? So what does it indicate? Why is it important, right? So it indicates if we do this and the baby is opening the mouth, then that means the baby might be hungry, first of all, okay? And second, this reflex is needed so that the baby is able to search for the mother's nipple, okay? Next is sucking and swallowing reflex. So sucking and swallowing reflex comes simultaneously, right? So you can see in the next picture that the baby is sucking, okay? And after sucking, once the mouth is full, the baby will swallow, right? So that is the sucking and swallowing reflex. So I think you know what is sucking and swallowing, right? So these are the reflexes in baby. Okay. Next, again, important slide. Okay. Types of breast milk, frequently asked question. Okay. Actually, the whole breastfeeding topic is important, and out of these, the topics, the subtopics that I am telling, important. These are frequently asked question in almost every entrance examination. Okay. So, types of breast milk, colostrum first. So, this is known as the first milk for newborn, also known as the first immunization for the newborn. Why? We will come to that. Okay. Secreted during the initial 3 days, right? Initial first 3 days after the delivery. Okay. It is yellow in color, thick and rich in large quantities of antibodies, vitamins, immune and growth factors, right? So since as you have seen, antibodies and immune factors are present in the colostrum, so that is why it is also known as the first immunization for the baby. Okay, so IgA is present in abundance in colostrum, right? Next is transitional mix. So after colostrum comes the transitional mix. So as we have studied, colostrum stays only for the first 3 days, right? Uh, Next comes the transitional milk, right? So it is less thicker than that of colostrum. So it is secreted after 3 to 4 days and continues up to 2 weeks. Okay. This milk has less protein and immunoglobulin, but more sugar and fat than colostrum. Okay. Next is mature milk. It is thin and watery, okay, but contains all the nutrients in appropriate quantity for optimal growth of the baby. Okay. Next, preterm milk. So it from the name itself, preterm, it is secreted from the mother who delivers preterm baby. Okay. So it is rich in proteins, sugar, vitamins, minerals, and water. So it is watery, okay, and satisfies the baby's thirst. Okay, so here the preterm milk contains all the necessary nutrients that is helpful for the growth and development of a preterm baby. Okay. Next is fore milk. So fore, from the name, fore means first, okay, or at the beginning, right? So this is the milk that is secreted at the beginning of any feed, okay? It is watery but enriched with proteins, sugar, vitamins, minerals, and water, and also it helps in satisfying the baby's thirst, okay? Next is hind milk. It is secreted. So hind means back or at the end, right? So from the name itself, again, hind milk is secreted toward the end of the feed. Okay, and it is rich in fat, which provides energy. And since it is rich in fat, it helps to satisfy the baby's hunger. Okay, so these are the different types of breast milk. Next, again, this is right? Frequently asked question, difference between cow's milk and human milk. So why should we give human milk and why cow's milk is not recommended for the baby? Okay. So this composition is in 100 ml of milk, okay, both for human and cow's milk. So protein present in human milk is 1.1 gram and in cow's milk is 3 times the human milk, right? That is 3.5 gram. If you remember 3.3 gram also, it's fine, okay? So 1.1 gram protein is present in human milk and 3.5 gram of protein is present in cow's milk. And the most protein, right, the common protein that is present in cow's milk is the casein protein, okay? You can remember by CC, and in human milk it is the whey protein, right? So whey protein is more easily digestible by the body, okay? That is why human milk does not cause diarrhea, okay? However, cow's milk casein protein is present, which is not easily digestible, okay, by the body. So that is why if cow's milk is given, the baby can easily end up in diarrhea, right? Next, calories. Calories are almost same. In human milk, the calorie is 65 kilocalorie, and in cow's milk, it is 67 kilocalorie, right? Then lactose. So more amount of lactose is present. So that is why human milk is sweeter than that of cow's milk. Okay. So that is 7.4 gram, and in cow's milk it is 4.5 gram. Or you can remember it as 4.7 gram as well. So if you rotate the numbers of human milk for lactose, that comes the cow's milk, right? 7.4 gram and 4.7 gram. Okay. Next is fat. So fat is again, fat quantity is almost same. So 3.8 gram for human milk. However, the fat that is abundantly present in human milk is PUFA, right? Polyunsaturated fatty acids, right? And cow's milk, the quantity is 3.7 gram. Okay. Next, coming to sodium and potassium. So sodium is 7, okay, milliequivalent per liter, okay, and potassium is 14, right? Next, in cow's milk, sodium is 25 and potassium is 35. So we have seen that sodium is very less in quantity in the human milk, right? So this slide, you can screenshot it or you can write in your notebooks, okay? It can be asked in question in your entrance examination, okay? Next, again, important topic, subtopic of breastfeeding, that is signs of good attachment. How do you know that the baby is attached properly to the mother's breast, right? So, first one is baby's mouth wide open. Okay, so the baby's mouth has to be wide open. Next, lower lip turned outward or everted out. In some books, it is also written as everted out, right? Next is baby's chin touches the mother's breast. Okay. Next is majority of areola is inside the baby's mouth, right? So all these 4 points has to be remembered, okay, for signs of good attachment. So here you can see this picture. The first picture shows good attachment and the second picture shows poor attachment, right? So you can see here the baby's mouth is widely open, right? You can see it's widely open, right? Then baby's chin is touching the mother's breast, okay? The lips are turned outward or everted out, okay? And most maximum, you can see this black part is the areola, right? So you can see this black part is the areola, right? So majority of the areola is in the baby's mouth, right? So these are the signs of good attachment. If the mother and the baby, okay, if they are having good attachment uh, towards the mother's breast, okay, then the mother will not feel pain and the baby will get adequate amount of breast milk, okay. However, if the attachment is poor, like you can see in the next picture, the baby's mouth is not wide open, it's slightly open, right? And baby is putting only the nipple in the mouth, okay? And the chin is not touching the mother's breast, the lips are not everted out, okay, or open outward. So it shows the poor attachment, right? So this can lead to sore nipple, okay, or leading to inadequate feed for the baby, okay, and the baby not getting the proper nutrition, okay. So this is very important, okay. Whenever you are in your clinical area, it should be taught to the mother about the good attachment and the poor attachment, okay. Sorry, I think okay, so Where was I? In the attachment, right? Okay, so here. So I hope you have understood about the good attachment and the poor attachment. Okay. Okay, next is the adequacy of feeding. So how do we know that the feeding of the baby is adequate, right? So we can know from some of the signs like baby passing urine for 6 to 8 times in 24 hours, okay? Baby goes to sleep for 2 to 3 hours after the feeds. Baby gains weight at the rate of 20 to 40 gram per day, or the baby crosses weight by 2 weeks. So this also needs to be remembered, right? So baby passes urine 6 to 8 times in 24 hours, goes back to sleep for 2 to 3 hours after the feed. So babies ideally should go back to sleep after feed, okay? And the baby should sleep for 2 to 3 hours. So after that, again, the baby will wake up for the next feed, okay? Next is baby will gain weight at the rate of 20 to 40 grams per day, and baby crosses birth weight by 2 weeks. Okay. That is about the adequacy of feeding. Okay. Now let's understand about the frequency of it. Like how frequently we should feed a baby. So time schedule is uh, like breastfeeding should start after 2 to 3 hours interval during the first 24 hours. So first 24 hours, baby might not be waking up, baby might be sleeping. So, but we should feed the baby every 2 to 3 hours, okay? Even if there is no demand feeding. Next, after that, the baby will start demanding for feed. Baby will start crying and showing the signs of hunger. So if the baby is showing the signs of hunger, then the baby should be breastfed. Okay. And as well as at night also, the baby should be given feeding, as I have already said. Okay. If night feeds are not given, okay, prolactin reflex will be hindered. Okay. If given, it will enhance. Okay. So that is why night feeding is very important. And also, night feeding should be given to avoid long interval between feeding and disturbed sleep of the baby. Okay. So the last point in bold letters I have already explained, but still I'm putting it here so that you remember it. Okay. Exclusive breastfeeding should be given for first 6 months, and breastfeeding to be continued till 2 years. Okay. Next, MCQs related to breastfeeding. Okay, before going to the MCQs, so let us see what we are offering in our online coaching. Okay, so if you are an aspirant for any type of entrance examination, be it NORCET, NEIGRIHMS, RRB, ESIC, CRE, or any other entrance examination of state and of any other entrance examination. So you can join with us, okay? So we have dedicated teachers for all the subjects, okay? So, okay, and this will be like a crash course. So the course will be for 4 months, okay? Where the classes are taken for 6 days a week, that is Monday to Saturday, okay? And Sundays are off, okay? And the next batch, the new batch now will start on 8th of December 2025. Okay. And if you are, old participant, you have already attended the online classes previously and you want to join again in this new batch, so there is a good news for you. There will be an extra 1000 rupees discount for you all. So for details, if you want to know more details, you can contact the phone numbers that are given here. Or if you want to register, you can scan the QR code that is given. Okay. So I hope to meet you all during my classes, right? Okay. So coming to the MCQs of the for related to breastfeeding. So which of the following response is expected in a mother suckling the baby? Increase of adrenaline, increase of prolactin inhibition factor, increase of hypothalamic dopamine, increase of oxytocin. So mother suckling the baby, what is expected? Increase of oxytocin, right? So yes, we have already studied about this. Next, refrigerated breast milk can be used for. So if we have, you know, extracted our expressed breast milk and we have kept in the refrigeration, so for how long it can be used for? 12 hours, 24 hours, 48 hours, or 72 hours. So this question also is a frequently asked question, okay? In every entrance examination, this is frequently asked, okay? So it can be used for 24 hours, okay? So the first form of milk secreted by breast during the first 3 days following delivery is called, I think this is the easy question. So transitional milk, hind milk, colostrum, fore milk. So we all know, right? This is colostrum. So as I was saying that fore milk and hind milk can be asked, the difference between fore milk and hind milk can be asked. So you can write down this slide, okay? Or you can screenshot it. So fore milk is secreted at the starting of the feed, okay? And hind milk is secreted at the end of each feed, right? So fore milk is watery and rich in proteins, minerals, and vitamins. And hind milk is rich in fats, right? So fore milk helps in quenching thirst of the baby, and hind milk provides satiety value to the baby, right? So we have already discussed about this when we were discussing types of breast milk. I'm just making it in table so that it is more clear for you, okay? Next, the benefit of breastfeeding is to strengthen the bond between the mother and the baby. It reduces the risk of breast cancer, to help the uterus to contract after delivery, or all of the above. So, it helps in everything, right? So breastfeeding helps in, it has many benefits, right? So, the answer is all of the above. Next is, which of the following is significantly different between human and cow's milk? So this we have studied: proteins and fat, proteins and sugar, proteins and lactose, or minerals. So it is proteins and lactose, right? So less proteins, more lactose is present in human milk as compared to cow's milk, right? So if you can remember the table that we have studied just now, right? Next is, human milk is preferable to cow's milk because human milk has a non-laxative effect. Human milk has more calories per 100 ml. Human milk has greater mineral content. Human milk offers greater immunologic effect. So this also we know, right? Uh, Human milk has greater immunologic effect, right? I have already told you IgA is being produced by the human milk and the baby gets the IgA from the human milk. Also, it gets all the immunity, all the antibodies and immunologic factors, right? So yes, so D is the answer. Okay, breast milk is rich in all except lactose, PUFA, sodium, lactalbumin. So another easy question. So it is sodium, right? We have seen that only 7, right? So sodium, okay? The answer is sodium. Introduction of solids along with breast milk is called supplementary feeding, complementary feeding, demand feeding, or scheduled feeding. So again, this answer is complementary feeding. We have already discussed about this, right? So when does complementary feeding starts? After 6 months of exclusive breastfeeding, right? So the immunoglobulin found in mother's breast milk is IgA, IgM, IgD, IgE. So I have discussed again and again, it is IgA, right? So which of the following is a major protein present in human milk? Lactalbumin, lactglobulin, casein, or lactoferrin? So the answer here is lactalbumin. So lactglobulin is also present in the human milk, but lactalbumin is more abundantly present in the human milk. And casein, we have already discussed, casein is present where? It is present in the cow's milk. What is present in the human milk? Which type of protein? Whey protein, right? And lactoferrin is a immunologic factor, right? So yeah, we have already discussed about this. Next, coming to BFHI, okay, it is an initiative which is uh, right, uh, which was launched, okay, for promotion of breast milk. Understood? So it might be asked. So little bit about BFHI I have put in the MCQs so that you are aware of it. Okay. So what is the full form of BFHI? Breastfeeding Hospital Initiative, Breastfeeding Health Initiative, Baby Friendly Health Initiative, or Baby Friendly Hospital Initiative. So it is Baby Friendly Hospital Initiative. So even though it promotes breastfeeding, the uh, the abbreviation does not start from breastfeeding. Okay, it is Baby Friendly Hospital Initiative. Okay. So the BFHI was launched jointly by, so it was an initiative launched jointly, okay, by two organizations, by UNICEF and WHO, WHO and FAO, UNICEF and FAO, WHO and Red Cross. So it was launched jointly by UNICEF and WHO, okay. So BFHI was started jointly by WHO and UNICEF in March 1962. Why it was launched? To encourage and promote exclusive breastfeeding worldwide. Okay. So coming to the objectives of BFHI, to promote drug therapy, to promote breastfeeding, to promote growth of baby, all of the above. So the answer here will be to promote breastfeeding. We have already discussed, right? So yeah, that is all about breastfeeding. So this is a very important topic. I hope you have gained some knowledge through this class, okay? And I hope to see you all in my next class, okay? Thank you all for your patient hearing.